We have all sorts of expressions out there, like pain in the bottom or a pain in the neck. Well, what about a pain on my side? Howdy y'all, Dr. Islam here, aka your poop guru, trying to give you the best tips and tricks so you can live your best life from the top all the way down to your bottom. That pain in your side could be indigestion, maybe some heartburn, maybe not a big deal, or it could be a sign of something else very, very serious. And how can you know if that's the case? In today's video, we're going to discuss appendicitis. And I want you to know the signs and symptoms of this condition so we can manage it early and doesn't cause a problem for you later on for both you and your loved ones. Guys, let's talk about poop. So I had a patient named Noah who had a really bad stomach pain. He went to his PCP, they tried him on different medications, couldn't really figure out exactly what's going on. But the pain got so severe, he actually came to see me in the clinic. I did a physical exam. I noticed, you are really tender on that right side. Well, there are only a few organs that are there. I pushed on there, and man, that pain radiated across his belly. And I knew for a fact, based on the exam, this patient had appendicitis. So I knew for Noah, we had to get a quick CAT scan, and which we did. We actually diagnosed him with appendicitis, pretty severe kind. Sent him straight to the surgeon, got his appendix moved, and he's doing so much better and not missing that organ anymore. So what exactly is the appendix? It is about a 3 to 6 inch organ that sits attached to your large intestine. And guess what? No one knows what it does. It just sits there and hangs out, just chilling, minding its business. But the occasional time something can block inside that appendix, it can become inflamed, and that's when you get appendicitis. Now, appendicitis can happen to anyone, any point in time of the year, and unfortunately, there are no real triggering events when it comes to that. So for example, food doesn't cause it to get worse, where other conditions cannot make appendicitis worse. What are the symptoms of appendicitis? Well, the cardinal symptom is pain, mainly located on the right lower quadrant, right down here. That pain can radiate across your belly button, but typically it's going to be in that right lower quadrant. You may also have fevers, chills, nausea, vomiting, things like that. But the most predominant symptom is right lower quadrant pain that radiates across your belly button. Now, if it's not recognized early, there is a risk of that appendix busting or getting open inside your belly, which can lead to severe complications and long-term antibiotics. And this is a very serious infection that, if it's left untreated, can kill you. Now, the only way for us to really diagnose appendicitis is with a CAT scan. So if you have severe pain on that right side, and I feel that, the first thing I recommend, like I did with Noah, is go straight to get a CAT scan to see exactly what's going on. And we can see if the appendix is inflamed or not. How exactly is appendicitis treated? Well, for everyone who has appendicitis, we'll give them antibiotics. And in a good majority of those patients, they do well on those antibiotics, and that alone will treat the infection and maybe even prevent the need for surgery. However, there are some individuals that need to get their appendix removed. And in most cases, it is a laparoscopic procedure, a couple of small little incisions, remove that appendix, and boom, you're good as new, and the recovery is very short. And if you can catch it early, there's an excellent chance you'll have no long-term complications from this. And once you get your appendix removed, there really is no change in terms of what's going on in your body. You have no other issues with that because that appendix is basically a useless organ. So what I want you to do this week is get more in tune for what is going on in your body. If you feel a pain on that side, especially on that right side, don't ignore it. Don't try and get some pain medication and say, not a big deal. Go to your doctor, see what's going on, and determine if you need to get further evaluation for that pain. My question today for you: what questions do you have about appendicitis? What concerns do you have? Comment down below. I would love to hear what you guys have to say. Guys, thank you for watching. Don't forget to smash that like button. Like, share, and subscribe. And if you haven't already, don't forget to subscribe to my weekly newsletter when you get great tips and tricks like you're watching in today's video. Guys, thank you for watching. Don't forget, let's talk about poop. Thanks, everybody.